Rural-urban migration coupled by inadequate housing has led to the mushrooming of informal settlements in Kenya. Now, these are characterized by poor sanitation. Here is an organization that is seeking to change that. Take a look.
An estimated 60% of Nairobi's population lives in informal settlements, often characterized by overcrowding and poor sanitation. In Kibra, Kenya's biggest slum, with a population of roughly 1 million people, water distribution and sanitation proves to be a challenge, prompting non-government organizations to deploy various solutions for the residents.
Well, the issue of sanitation, more specifically touching on the low-income settlement, a lot of these settlements have been put up in controversially owned places in Nairobi. For example, Kibera for a long time has been known to be an illegal settlement because it was not planned. It's people squatting on government land. So such a scenario therefore portends a situation where government doesn't plan for the provision of basic services, including water and sanitation. Now, looking at places like Mukuru, people are squatting on private land. So therefore, it means that government cannot actually plan to provide the services for the people living there. With time, and given that this continuous migration from the rural areas to the cities, and the population in this area has kept on steadily swelling.
One of such organizations is Umande Trust, who set camp in the slum in 2004 and has since been helping residents address overpopulation-related challenges by constructing sanitation biocenters.
In the informal settlements, as you know, most of the structure owners were constructing their structures without taking into consideration the issue of sanitation. And that's why you are hearing the issues of, you had the issues of flying toilets. Yeah? These flying toilets are not the toilets that are flying, but basically they are, most of the community members used to relieve themselves at the household levels, whereby if you have your kids in the house, you might chase them out, you relieve yourself in a polythene bag, then you peep outside the window like this, like outside the door, to look around whether there is someone who is passing around. If you don't see it, then you just throw it away like that. So where it's going to land, even if it lands on someone's head or wherever, you don't mind about that.
The biocenter facilities host kitchens, bathrooms, and toilets where slum dwellers can access the services at a fee. They also act as human waste collection points, which is then digested into biogas for use within the amenities.
The cost of using the facilities ranging from the toilets, the bathrooms, and sometimes community halls and offices that are in the facility vary from one place to another. For example, in this facility where we are, using a toilet is 5 shillings per visit. Though there is also provision for monthly payment for a household, which then takes care of, if the cost. If you're a family that is made up of probably even 6 people, and you have to pay 5 shillings every time you visit the toilet, then it becomes very expensive. So what has happened is that the community around here agree with the groups that run the facility so that they pay monthly instead of paying per visit. The monthly payment ranges from 200 and 250 per month, per household, irrespective of how many people are in that household. Okay. For the bathrooms, it's also 5 shillings for cold bath. But if you want to take a warm bath, it's more costly. You will be charged 10 shillings.
The project, which is mainly operated by the community, has received backing from the Kenyan government.
We work closely with the government, and in this line, I will pinpoint the Ministry of Health, and within the Ministry of Health, the public health, which Umande works on a day-to-day issues based on our field of operation. We do partner on so many issues, and one of the issues that I can now pinpoint out clearly is that right now the menstrual hygiene management policy development is the policy is being developed, and Umande is part and parcel of that process.
At the start of the project, many residents in the neighborhood perceived the facilities and digestion of human waste into biogas as unhygienic. However, Umande Trust has worked hard to get rid of the negative attitude, and now revenue generation is on the high.
For example, this one would probably take in about maybe 100 in a day. Others would take as high as 500 in a day. Like this one down here, the first one actually to be put up in Kibera, it's called Tosha, that sees between 500, 700. And sometimes during the weekends, it goes up to over 1,000 people per day. And from that, they're also been able to generate a lot of money from that. Actually, their income ranges between 120,000 to 150 per month.
The project has proved bankable, and apart from its expansion into other informal settlements in the rest of the country, Umande Trust is now moving a step further to increase its service provision.
We are now in the process of developing a plant that will then use the bioslurry from all the biocenters, especially in Kibera, to produce biogas and fertilizer at a commercial scale. Now that is envisaged to produce adequate income to support the services that the organization provides.